Hello everyone, I'm Nancy Cox and welcome to this digital conversation, a very topical, timely one as so many folks are getting ready to head back to school. Some people go earlier than others here in Fayette County. Still have a couple of weeks, but there are a lot of things you need to know, including about your children's health and immunizations. And joining us today from the Fayette County Health Department is Jill Keys, and she has a lot of good information for us generally, but first, we want to get to some big changes as far as the immunizations go that your child is required to have. Not recommended, but these are new requirements, right?
Correct.
Tell us about those.
So the regulations changed as of July 1st of this year. So the hepatitis A is now required vaccine for children that are entering daycares and kindergarten through 12th grade. Mm-hmm. So a lot of the kids have already had that vaccine, so really check with your doctor to see. If they have, you'll just need an updated certificate. If not, then you'll just need to make an appointment to get that. The other change is the meningitis. The students are already getting that at 6th grade, but now they're recommending a booster dose at age 16, and so that has been added to the requirements.
Okay, so we're not just talking school kids, kids of school age. You may be a parent and think, oh, kindergarten's a little bit away, but if your child's in a daycare, let's point that out again. These are also required.
Right, so if your child's over 12 months of age, then you need to talk to your doctor about the hepatitis A vaccine.
I know you guys work closely with the physicians in this community, and all communities do with their local health departments. So you can, if you're unsure about this, especially if you have more than one child and you're trying to juggle, and remember, they can just give their physicians a call, right?
Yes, and these aren't new recommendations. As I said, they're new requirements to our Kentucky immunization regulations. However, they've been recommended for several years. So a lot of the pediatricians in town are already giving these vaccines.
Do you get a lot of calls still about with the immunization questions with some of the attention over recent years about some of the immunizations and some groups who fear some side effects? Do you still deal with a lot of that? Or here in Fayette County, Lexington, is everyone pretty much understanding of the regulations?
Well, we do have a few that are parents that object to vaccines, but anytime anybody has any questions, then the nurses can certainly answer any questions that you may have. Or, you know, it's really great during your child's physical with your pediatrician to talk to them about any concerns you have about where to go to get additional information. CDC has some information sheets on vaccines that are great. They have information that's geared towards parents. So if you have any questions, certainly do your research with the CDC, talk to your pediatrician, call the health department, speak with one of the nurses.
Remember the websites, the internet, those are tools.
Right.
You might get a question raised there, read some about it, but go to your health professionals, go to the health department to really get to the bottom of this. And like you said, the CDC website is a great resource. Okay, well, there are lots of other concerns that parents have right now going into the back to school time, so we want to address those as well. Let's say your kid's starting school for the very first time. We know they will need a physical. Tell us about those kinds of requirements.
So any child that's entering kindergarten or 6th grade or entering a public school in Kentucky for the first time. So your child's transferring from a private school or your child's transferring from another state. They will need an updated immunization certificate. They will also need a physical, that's a recent physical. So talk to your doctor to see how long it's been since your child's had a physical. A lot of children will have yearly physicals. If it's time to have that physical, when you go in, just ask for a school physical form to be completed. If your child's older and in sports, then that is required yearly as well. So when you're there with your physical, talk to your doctor, make sure you get a copy of the sports physical completed.
And I found it's always a good idea too to get 2 copies or take the copy, make your own personal copy because either a kid leaves it in a backpack or maybe it gets lost in the shuffle. So it's much easier to make those copies now than make another appointment or zip by that doctor's office. More information about any of these concerns or questions, I know that the health department is a local resource, so let's give that phone number if we can, and also that state website where I mean, people can watch this anywhere in Kentucky, so they may need to know where to go to for help in their community. So what are those resources?
So if you want to call and you have a question about immunizations, or you're wanting to schedule an appointment with the health department, you can call our clinic appointment line 288-2483, or you can go to our website to get some additional information about the different services we offer, and just some information about the requirements for school is on there as well. And then the Kentucky Department of Public Health also has a website that you can go to, and they have a direct link to the immunization regulations, an updated immunization certificate, and additional information about that.
Good. Very, very good to have that at our fingertips. I would think that you suggest folks go ahead and make those appointments for these physicals now. If you haven't already, don't wait till the last minute.
Right. The closer it gets to the start of school, the more people are calling to get appointments, the fewer appointments available slots are with your pediatrician. One thing to remember is if your child is going to be trying out for sports, your child cannot be on that field or on the court until that certificate or that form is filled out. So it's better to go ahead and schedule that appointment now. When you're there, you're not sure your child's going to try out for sports, then go ahead and just ask for the form. Go ahead and turn it into school so it's on file.
Don't wait to see if they make the team. Go ahead and take care of this. And we do have more options now in Lexington and a lot of the communities with the little clinics in some of the Kroger stores and some of the other big box stores around town. They have their own clinics that may be a little easier to get into. Anything else parents need to think about on that first day of school or thereafter that you guys at the health department always see come around every year at this time?
Really, you know, just making sure you have all the paperwork. You've talked to your school, you know, in the next couple weeks, the staff are going to be coming back. So, you know, you can reach out to your school to see if your child has everything or if they're missing anything. Throughout the year, we're going to be reviewing those records and sending notes home to parents or making phone calls. But, you know, if you're at the doctor, go ahead and get a copy of the certificate, the immunization certificate, turn it in. Just, you know, really just follow up with your school and your physician, and just make sure everything's in order.
And I would suggest, from personal experience, if your child has a food allergy, if there are any special accommodations that need to be made in the cafeteria because of that, go ahead and get that paperwork now. Can they do that?
They can. You can talk to your school about the information that you need. There's packets that we typically send home on the first day of school, but if you know that these accommodations need to be made in advance, then it's best to go ahead and contact the school. You can go into Fayette County Public Schools website to find the packets and the information. The health department's website also has some links to those forms. Go ahead and have them fill it out. There's a part that the doctor needs to sign if it is a food allergy and we need to make some modifications. Certainly go ahead and get those filled out. If your child has asthma or seizures, there's information on that as well that you can fill out, or complete, and go ahead and get that turned in, get your child's emergency medications to school, so that we have all of that on the first day.
Again, personal experience, we have the food allergies, we have the asthma, the EpiPen, the inhaler, all that, and definitely this year we're going to start early because on that first day of school you get a lot of paperwork, so get a jump on it. Well, we thank you so much for being here, and we thank you for watching this LEX 18 Digital Conversation. We may see you again throughout the school year. Who knows? Lots of issues come up, right? And we thank you for watching. You can find this digital conversation and many others at lex18.com. We'll also link them on our Facebook page. Please share them.